Good afternoon. Today we'll be discussing caring for refugees and the experiences that follow seeking health care as newly arrived refugees into Canada. So first we want to talk about what is a refugee. According to the United Nations in 2024, refugees are people forced to flee their native country to seek safety in another country due to feared persecution, ideology, religion, armed conflict, violence, or other serious public disorders. The largest single group of refugees arriving into Canada, according to the Immigration and Refugee Board of Canada, are from India, with 41,698 people pending for approval for entry into the country as of July 30th, 2025. And the country with the most refugees whose claims were accepted in Canada is Turkey, with 2,200 applicants. Caring for a refugee will undoubtedly present its own unique challenges: cultural barriers, language barriers, even a lack of awareness of the resources that they have available to them given by the respective provinces. I'm joined today with multiple experts on the topic to discuss these experiences refugees have with the Canadian healthcare system in greater detail. So I'm joined today with Aya. Aya, thank you so much for coming in today.
No problem.
So I want to ask, first of all, why do people leave their home countries to come into Canada?
Yeah. So people leave their home countries because it's not safe for them to stay. Refugees are often forced to leave due to war, violence, and discrimination or poverty. For example, millions of Ukrainians, mostly women and children, left when the war began in 2022. Many face poor living conditions or lack to healthcare, jobs, or education. Others flee because of trauma or unsafe environments to find safety and better opportunities in countries like Canada. They are forcefully displaced, meaning they leave not by choice but for survival. During displacement, refugee children often lose access to vaccines or treatment for illness like diabetes, putting them at a higher risk of health. Mothers and children migrate to rebuild their lives in healthier and more stable environments, hoping for safety, education, and healthcare that are unavailable in their home countries.
Okay, excellent. And how do refugees' past experiences of war, displacement, and their physical and mental health, how does it affect their trust in the healthcare systems?
So refugees who have gone through war, violence, or trauma often have both physical and mental health problems when they arrive in a different country. They may suffer from stress, depression, or anxiety, and their health care declines after coming to Canada. And also language barriers, discrimination, and culture differences make it harder for them to communicate with doctors or understand a new medical care advice. Many refugees don't know how the healthcare system works or can't afford care, which leads to fear and mistrust. Many newcomers also have low healthy literacy, meaning they don't fully understand how to access or use healthcare services. Some women avoid doctors because of cultural reasons or because they don't feel comfortable with a male doctor. Lack of health education and limited English also make it harder to manage their health.
All right, excellent. Well, thank you so much, Aya. I appreciate you coming on.
No
Thank you.
problem. Anytime.
All right, so I'm joined here today with a licensed healthcare worker. Rain, thank you so much for coming on the show today.
Thank you so much for having me.
No worries. So I wanted to ask you, what would be the first step a refugee can do who's newly arrived to Canada if they want to access healthcare?
Well, the first step they have to do is to have an acknowledgement of claim, which is sent when they make a refugee claim when they get into the country. Then they'll have to have an intake interview to receive either a refugee protection claimant document or a refugee protection identity document. And if you are a resettled refugee, then you can receive an interim federal health certificate. Then once you have any of those documents, you're ready to go to the next step.
Okay, excellent. What are the services that are available if a refugee wants to access this?
Some of the services available are the IFHP, the Interim Federal Health Program. This program provides urgent care for refugees who are not yet covered under a healthcare plan. Under the IFHP, refugees can receive coverage for hospital service, for service from healthcare professionals, for ambulance service, medications, diagnostic services, essential vision and dental care, and more. And it also covers the immigration medical exam that is necessary when you get your citizenship. Once eligible, you can access services through OHIP like anyone else. And also, some cities like Toronto have clinics that offer primary care to refugees specifically, but it's not that widespread.
I see. Are there any services that are not available, some that you can't access?
Yeah, so anything that can be claimed under another plan. So anything that you can claim under your work or personal plans is not valid under the IFHP.
I see. Are there any barriers that a refugee might face if they're trying to access healthcare in Canada?
Yeah, so one major barrier that people can face is the language. Many refugees fleeing violence don't know English or French and don't have the time to learn it. So it's difficult to communicate. It's difficult to do everything from emails to forms to phone calls and just navigating the healthcare system in general. Some clinics aren't registered with the IFHP, and over-the-counter medications and many other prescriptions cost money that refugees may not have. So even if they're able to receive the care in the first place, the medications that they need to sustain long-term things, such as if they have pain or allergies, might not be covered, and they might not have any source of income to afford that. Also, clinics are very sparse, so each patient has to travel a long way, sometimes across an entire city. For example, in Ottawa, there's the Heart Institute in the center of the city, and if you're far away, you might have to travel to get there. Many refugees don't have access to their own transit. They don't have a car or a bike or anything like that, and they can struggle with the new confusing public transit system since they've never been here before, and also they don't speak the language. Some refugees are also coming from authoritarian regimes or war, so they might have a distrust of institutions. Past trauma, as already mentioned, can lead people to not seeking proper medical care out of fear or apprehension of what might happen to them. And also, some refugees might have traditional beliefs that discourage them from seeking modern treatments, such as blood transfusions.
Absolutely. Knowing this, are there any strategies, because you're a healthcare worker, so I imagine you use these, are there any strategies that you use in your practice to kind of improve this situation?
Yeah, so one important strategy is trauma-informed care. It's important to know where everyone's coming from and what everyone's been through so that you understand how to give them the proper treatment. It's important to put the client first and center the client to make sure that you don't, cause any issues that might make them have more apprehension to the medical system and make them have more difficulties with the medical system. You want to make sure that every step along the way is easy and centered around them. Another strategy is to hire people of diverse backgrounds. So you want to have people from all sorts of backgrounds working in your clinics and your healthcare places so that they are able to understand different people's experiences and provide the best care possible. Another thing that would be important is to allocate more funding to refugee response clinics and to the healthcare system in general because it's overloaded, but there's not enough money to relocate everywhere, unfortunately.
Okay, well, thank you so much for coming on today.
Thank you very much for having me.
We appreciate it. All right, so today we are joined by psychologist Aisha. Thank you so much for coming on.
Thank you for having me.
No problem. So I wanted to ask you, how does the aftermath of living through war change someone's healthcare needs?
Surviving a war can change someone in every possible way. The way a person interacts with their diet, their mental health, and other issues, they'll never be the same again. And a big example of that is people who have to live in a refugee camp. Children, elderly, and pregnant women are already a greater health risk and need to take care of their health when they're safe. But when there's a war happening, people can't focus on taking care of themselves because they're trying to stay alive and stay safe. Refugees experience trauma that distracts them from their needs, and they might begin to feel that healthcare has lost its importance. PTSD is a sociological disorder. It happens to someone who has experienced severe trauma. A person can go through sexual assault, witness another person dying, or even nearly die themselves and experience PTSD. Now, all those examples are very common for refugees to experience, and because of that, there's a high percentage of refugees with PTSD. PTSD is a psychological disorder. It completely changes how somebody thinks, acts, and lives, and it stands for post-traumatic stress disorder.
All right, thank you so much. I wanted to ask you as well, how does it change how that person accesses healthcare?
It changes how that person accesses everything, and healthcare is a big part of a person's life. It's a place where a patient needs to be vulnerable and put their trust into a healthcare professional
But sometimes when you suffer from a psychological disorder, you become distrustful and self-reliant. Think about a person who hasn't experienced war visiting a mental health professional. They might not be able to open up themselves. When you have PTSD, those issues have increased dramatically.
Okay, well, thank you so much, Aisha, for coming on and explaining this.
Of course. Thank you for having me.
No problem. So today we are joined with Amanda. Thank you so much for coming on.
Thank you for having me.
Appreciate it. So I understand that you know someone whose name is Faria, who's a Somali refugee into Canada. Can you explain to me her experience?
Yes. So Faria is a 29-year-old refugee who just moved from Somalia, Hargeisa, to Canada, Toronto recently. She moved with her 9-year-old little sister that she takes care of. After escaping the war in Somalia, the parents got separated and are still living in Somalia. Faria sought asylum and is currently living in a UK. So yeah.
Okay. What concerns my Faria in person?
Yeah, so currently she's been having severe headaches and blurred vision for the past few weeks. But as a recent immigrant, she's unsure how to navigate the healthcare system. So she's having trouble finding a healthcare provider that accepts IFHP. And also, her systems are interfering with her abilities to learn her English classes to focus, and which is important for her to find a job. So she's hesitant to seek help, but she knows how important it is, so she's ready to do it.
See, I imagine she has to experience some kind of issues with this, such as wait times.
Yeah, exactly. So the wait times are long in Canada, so she's also worried about paying out of pocket for medications and prescriptions. Some other ones that she might be facing are the language barriers and understanding her treatment when she gets that. Another one is her mental health and accessing the support. So adjusting to Canada is obviously hard for her. She's worried about her parents still living in Somalia, and she's hesitant to seek help due to the stigma around getting help in the Somali community. So yeah, she's just unsure. But yeah.
Well, thank you so much for coming on.
Yeah.
Healthcare is a vast and complex system. It encompasses different styles of treatment, and that treatment can vary depending on where you are geographically. This is an important detail to understand in regards to treating a refugee, as we have heard from the several experts we had on here today. We have heard our experts reference trauma-informed and client-centered care, how these treatments build a sense of control and empowerment, and how these treatments put the client's needs and preferences before the needs of the healthcare worker. Finally, how these techniques can be used to treat a newly arrived refugee. There will no doubt be challenges presented, some even the experienced healthcare worker may struggle to comprehend. However, using these techniques, as presented by the experts, can be an informative guide into creating an environment where the client can feel safe, empowered, and heard.